so often when a caregiver or a family member calls me, um, the they're no matter where they are along their journey, they often express concern that they're just not capable of either taking on the caregiver role or continuing in the caregiver role. So it's critically important that we are able to provide them with counseling and education and connection to wraparound services to be able to help them to become more confident in their role. And next is to empower the caregiver to become an advocate for their own needs as well as the needs of their loved one. And advocating is one of those surprising and unexpected elements of caregiving, I think, that most caregivers are not aware of or aren't sure how to do. To advocate within their own social systems, might be their family, could be the healthcare system, facilities are really huge. So again, it's really important for us to be able to educate and provide resources and counseling to empower caregivers to take on this role when it's needed. And finally, to connect caregivers to a larger community of support, either through connections and services in the community or within the county, or to other caregivers through support groups and discussion groups, which I'll talk a little bit about later. So for me, in order to accomplish these goals, my work falls within some distinct sort of categories that I'm going to review really quickly: information and referral, caregiver counseling, caregiver education, and caregiver discussion and support groups that I facilitate, and always providing ongoing connection and support as needed. So I highlighted that one because I have to say one of the great joys of my job is that with many caregivers and family, I get to walk alongside them and provide them with ongoing support over time as their needs change. So that is one of the things that I always want to include in my caregiver program. So information and referral, we'll just go through some of these, is a broad term that relates to speaking with caregivers and family members of caregivers and provide counseling. So when a caregiver calls me or a family member calls me or a relative calls me from even out of state, you know, they're recognizing that there's a need. It's either emerging or it's imminent or they're in a crisis. So it's my job really to listen to them. I ask questions. I ask lots of questions so that I can learn who they are, who their loved ones are, what their needs are, what their strengths are, what their current supports are and resources are. So I can really sort of assess the needs and prioritize. So we're looking, of course, first at immediate needs so that we can take bite-sized pieces of what needs to be done or what needs to be put in place or what needs to be learned so that it is not becoming overwhelming. So we want to create little bite-sized pieces with immediate needs. And then we're going to look at long-term needs and help devise a plan together. So planning does provide counseling, does provide information, sometimes obviously providing referrals to assist and to link them to services either at the county or across systems. Now, I do often refer caregivers to services outside of the county, but today I really want to focus on the incredible services that are available within the Onondaga County Office for Aging. And I'm going to highlight three of the services that I refer to most often. That would be New York Connects, our nutrition services, and our transportation services. So New York Connects is probably one of the best programs ever instituted in New York State for caregivers. They provide a one-stop access for free, objective, comprehensive information and assistance on long-term care services for people of any age, of any disability, of any financial status, and of course, for caregivers. In fact, just recently, the New York State Office for the Aging published a report that shows that caregiver supports continue to be ranked in the top third of all topics being requested through New York Connects across the state. So it is a really important access point for caregivers and one that I refer to very often. So
hey, Kimberly, I apologize for interrupting. Did you have a PowerPoint that you were sharing with this information?
Oh, yes.
Yeah, okay. Thank you. Yep. Just have
Okay,
you share your screen.
Okay, I'm sorry. It's
No
not
worries.
Oh, this is terrible. Sorry. I pulled it up and I didn't share. Okay, hold on, folks. Okay, so we're gonna go from beginning, but we'll slide through here. But this has, so the PowerPoint has the information that I reviewed in the beginning. These are the some of the goals that I have. Okay, hold on. I need to go from beginning. Okay. And okay, so here we are with New York Connects. So I'm so sorry, folks, but New York Connects, again, is one of those amazing programs that I refer to often when caregivers want information, and they often do, about Medicaid managed care, Medicaid managed long-term care programs, consumer-directed services, respite services, care management services, services that or eligibility requirements for any of these services. I always refer over to the New York Connects team that will help give them really locally based information about long-term care services that would really help them make informed choices. And I just want to say that our New York Connects team is staffed by incredible men and women who are very knowledgeable, very compassionate, always learning, and really willing to take the time with individuals to help provide them with information that's needed. So I'm always very proud and very confident when I'm able to, transfer someone over to the New York Connect services. And also when I refer a caregiver to New York Connect services, we're able to actually collaborate on their care together. So I can talk with New York Connect's team and learn what types of services and referrals were made on their behalf. And then I can actually round back with the caregiver to discuss those options and to help them make decisions and set things up for themselves. And then I can also discuss with the New York Connects team about any new or emerging needs that occur with the caregiver or the family that they may be able to help with. And so that collaborative relationship is really, really important within our county system. And then another incredible resource that New York Connects has is the New York Connects resource guide. This can be found on our website. I'll just click onto it very quickly and show you. It can be downloaded and saved to your computer. This is really 130 pages of just almost any kind of information that you may want. So I encourage all of my caregivers to download and save this resource because I know it will quickly become a go-to resource for any caregiver to have. And if they don't have access to a computer, they can contact me and we can get them something from the office for them. So please reach out anytime, but it's available on our website as well. Excuse me. Nutrition services is also another one of those programs at the county that I refer caregivers to often. Particularly Meals on Wheels is one that I refer to for long distance caregivers and caregivers who cannot see to their meals of their loved ones on a daily basis. As you probably know, they deliver 2 meals a day to individuals. Their meals are delivered Monday through Friday, and they really have a group of incredible, dedicated, and caring individuals who visit individuals and provide those meals. One of the kind of pushback that I often get when I refer Meals on Wheels to caregivers is, oh, I don't think my love, I don't think mom is going to go for that. It's not good food. But honestly, I encourage everyone to take another look at it. Meals on Wheels has come a long, long way, and they really provide excellent food. The menu has been expanded and enhanced with some incredible choices. These are just some of the options that are available. So I really recommend that people look to this as a resource if they're concerned about having their loved one eat healthy foods and be able to eat daily without having to prepare them for themselves. So caregivers overwhelmingly report to me a sense of release and comfort when they do get Meals on Wheels. Really knowing, first of all, that their loved one is receiving healthy food every day and perhaps more important, that somebody actually has eyes on their loved one on a daily basis when when they're not able to be there in the home to see them. So this is an excellent uh, it's an excellent option for you caregivers who really need to make sure mom or dad or your loved one is eating on a regular basis. Our nutrition services also include nutrition counseling. We have one-on-one counseling with a registered dietitian. There are 3 registered dietitians with the county, and any one of them will be willing to talk with you to discuss what kinds of nutritional changes may be needed as you're caring for your loved one, as their disease progresses, what should be included on their diet, what maybe need to be excluded. Um, Also, they have monthly nutritional education programs. Those are offered on a virtual platform, and they're really good interactive programs where you can ask any question that you have about your about the diet or nutritional needs of the person you're caring for. You can help develop a meal plan for them, figure out options that are easy to make so that they don't have to cook or microwave or do anything, but have healthy options. So these are services that I routinely recommend to caregivers. And for more information, I recommend you contact our nutrition services coordinator. That's Heather Hudson. Her phone number is listed here, but you can find information about nutrition services also on our website. Sorry, my voice. So transportation services is also another service that I often refer caregivers to, because medical transport is often an issue, particularly with older caregivers who don't have the strength or the ability to transport their loved one, or caregivers whose loved ones are in assisted living or other facilities. And through the county, we offer a number of different transportation programs that offer services throughout Onondaga County. United We Ride is just one of those programs. But if you or your loved one is a resident of Onondaga County and have a need for medical transport, please just call and speak with our transportation coordinator. That would be Larry Matthews. He would be perfectly willing to help you set something up, either on a one-term basis or long-term. It's an incredible service that we're proud to be able to provide. As I discussed earlier, when I was talking about the goals of caregiver services, connecting caregivers to a community of support is extremely beneficial, and it's a definite cornerstone of our caregiver services. So whether you're a full-time caregiver, part-time, long distance, formal, informal, you really can benefit from joining a support group. They can provide validation, encouragement, understanding, advice from others who have gone through or are going through situations that are similar to what you're going through now. It's just a relief to know that what you're going through is normal, and then you're not the only one feeling the way that you do. Caregivers can also learn coping strategies or find solutions to common problems, or just develop friendships, which will help sustain them along the way. The caregivers in the support groups that I facilitate, many of them have developed relationships that go outside of the group. So they can call them at any time of day and night if they're feeling stressed or have a question or a need, and they're really supporting one another even outside of the group. So those are just some of the reasons why we feel that support groups are an important part of the caregiver's toolkit, and why at the county we make them a priority. So unfortunately, in 2020, the support groups were meeting in person and they were put on hold because of the pandemic. But in the fall, we reinstituted them again, and we offer them now on a Zoom platform. And we look forward to the time that we're going to be able to meet with people in person again. But we have found that providing a virtual platform does offer greater flexibility by eliminating either geographic or weather-related barriers to attendance. And many caregivers find it difficult to either leave their loved one at home or to find someone to come in and care for them while they are attending a support group. So we will probably always keep a virtual option within our support group framework. Currently, we offer and I facilitate 4 support groups a month. We offer 2 on in the afternoons and 2 meetings in the evenings for caregivers who are working and cannot are not available in the afternoon. Their caregiver groups are open to everyone, whether you're a professional or caregiver. Um, there's access is open to everyone. The link and the access information is the same for every group to make it easier for anyone to join. I'll just link quickly to our website. All of that information is on our website under caregiver services. You can see the link to the Zoom room is there, or you can join the meeting by phone if you don't have access to a computer or a laptop or a tablet or a smartphone. You can join there. You see that we have the names of the support groups are still named by the facilities that originally sponsored them. So we kept them, and perhaps we'll be able to offer them at those places currently, but or in the future, but currently they are on a Zoom platform. And just so you know, I do offer technical assistance to anyone who struggles with using Zoom. And I have found really with a little bit of help that almost every caregiver is willing to give it a try, and it's worked out very well. So if you have any additional questions, you know someone who wants to who might benefit from a support group, or you yourself, please give me a call or just go onto our website and go ahead and click on any group that you want to join in. Our group members are welcoming and compassionate and understanding and very some of them are very experienced, and I think you'll find real benefit to it. So another pillar of support to help meet the caregiver goals that I outlined is caregiver education. And many years ago, the Office of Aging developed the Institute for Caregiver classes. They really help support and empower both current and future caregivers through education and training. The Institute for Caregiver classes were developed to provide education and training that are broad enough to pertain to a number of different illnesses, but comprehensive enough to be able to provide tools and meet the needs of caregivers regardless of their situation. So again, unfortunately, the eye care classes in 2020 were put on pause, but we began offering them again in 2021. So in 2021, we offered so far oral health and the caregiver, which received a lot of amazing support. Apparently, that is a great need for caregivers as their care receiver ages. Recently, we had offered Medicaid in 2021. This is an overview. There's been a lot of changes in Medicaid in 2021, and this was a extremely well received program, and one that we will be offering again because it's one of the topics that is number one on caregivers request list whenever I ask what kind of education they would like to see. So, but you can find recordings of these classes and other classes on either our website or our YouTube channel. I can just on here, and you can see that these classes are all here for you to check out anytime that you want if you can't if you haven't joined in on them personally. The upcoming classes that I'm working on for the next few months will be on managed Medicaid managed long-term care programs. This is another topic that caregivers often ask me for education on because it's a bit of a mystery and there's so much to learn. So we're looking forward to being able to present that for the community. I'm developing a class on technology to aid the caregiver. There's just so many innovative, incredible technological advances to help aid the caregiver that are really not really overly expensive and not very difficult to implement. So we're going to be doing at least one class and perhaps a series on technological aids for the caregiver. In the fall, we're going to be partnering with the Alzheimer's Foundation to do a series of communication specifically for persons with dementia and communications issues at varying points um, of the disease trajectory, so each stage. And also I'm developing a caregiver forum series. So we're looking at more experienced caregivers who have a desire and an ability to help provide education and information for newer caregivers on a number of various topics. So that's very exciting. I think serving community is really important, and engaging the caregivers to help other caregivers is a great way for them to make meaningful what they have gone through in a way that they haven't before. So I look forward to that too. If you are on one of our mailing lists, you're going to receive information about each of these educational programs and how to register. However, if you're not on any of our mailing lists, you can just reach out to me at the county, and I'll make sure that you get on them, and you'll be able to get information about upcoming education and how to register. Now, finally, one of the other great joys of my job is to be able to provide Joy for All animatronic companion pets to the loved ones of caregivers. Now, we all, I think, know the benefits of having a pet have been well documented, but older adults often have to give up their pet when they can no longer care for them, or if they have to go into a facility, the pet is obviously not going to be welcomed. So while not for everyone, research shows that these animatronic pets can benefit people, can help eliminate stress and anxiety and depression. These pets have a few different settings, so they're interactive. They have different pressure points, so when somebody is petting them, they may turn their head and look up to them, or purr, or mew, or do a little yip. They'll turn over and move around, and they're just absolutely, for some people, a wonderful way to feel connection and feel like you're caring for someone. And we offer these adorable pets free of charge to caregivers who would like one for a loved one. All you have to do is ask, reach out to me at the county, and I'll make sure that we get one in the mail to you at no charge. And I hope that people will, begin to take advantage of those. So that's it. I don't know what my time is, but I really appreciate your time. Sorry for the initial blurb on my PowerPoint, but I just want you to know that every day at the county, we strive to make a really positive difference in the lives of these incredible men and women who are giving so much of themselves to others. So it is my joy to support you, and please give me a call.
Thanks, Kimberly. And will we be able to share your PowerPoint on the event website? Would that be okay?
Oh, absolutely.
Yeah, so everybody look out for that. So I know there were a lot of names, contacts, right, programs. You can check it out on the website. We'll upload it as soon as we can with all those numbers if you missed it. Okay?
Okay.
Thanks. And I'll ask you to stop sharing your screen too, Kimberly.
Okay.
Thanks.
Thank you so much.
Oh, thank you. Appreciate it. And we recognize that we're a little low on time. So we do have our next speaker, Maria, and she is talking about a lot of the statewide initiatives we have going on in New York. And so we hope to hopefully make another video and share it with all of you and put it on the website and everything, because we know we're short on time today. But Maria is going to talk a little bit about where you could find her information about her organization and everything. Thanks. Thanks, Maria.
Thank you. I'm going to share my screen just for a moment, but I wanted to thank Senator May's office and of course Sam for all of the information that you're doing here and for inviting us. And there's been a wealth of information on caregivers and all of the things that the county offers. So I'm very happy to be part of this group. New York Statewide Senior Action Council is a nonprofit organization, and we're a member-driven and member-governed organization, meaning that our board of directors and the actions that we take are fully by consumers whose interest is in in improving the quality of life of seniors in New York State. We have chapters throughout the entire state of New York, as our name would say, right? And in Central New York, if you see here, we do have an initiative of these counties where we have a chapter that we have two chapters actually, one in the Finger Lakes and one in Ithaca in Tompkins County, and where we have members that get together. It doesn't matter from what county you are, you could always attend and talk about how to improve conditions in their own communities. Another thing that we do, our mission has been to improve the quality of New York State senior citizens and families. Next year will be our 50th anniversary, so we're very proud that we've been in the community serving and accomplishing quite a bit. And it's in part due to the incredible partnership that we have with policymakers and with different legislators, including Senator May, who's been a wonderful champion of senior rights in New York State, as she is also the chair of the Senate Aging Committee. Our issues run from the rights of patients and their caregivers, patient safety, improving the quality of care of healthcare, prescription drug costs, Medicare rights and issues like observation status. We are one of the original single payer healthcare, the New York Health Act law, and safe nurse to patient staffing ratios. And these are a lot of the issues that improve the quality of life and rights of consumers and patients in New York State. Just a little bit of background, New York State has 3.2 million, out of 3.2 million New Yorkers, or nearly 1 in 6 are age 65 and older. And the older adult population is growing faster than any age group in New York. So for that reason alone, senior issues and senior advocacy is very important. And the reason why caregivers are so important is, number one, because many times the caregiver is assisting the person who's 65 and over, but more and more as the baby boomers age in, the caregivers are becoming senior citizens 65 and over. So all of this information that you've been hearing today and what we're trying to do will affect everybody as time goes on. So we also have, in addition to our advocacy, we have some helplines that are toll-free, and we have certified, unbiased staff that provide patients' rights. So for people who are either hospitalized or in a nursing home, if the caregiver or the resident feels that they need to learn how to assert their rights or have a question, they could always call us. And we also have the Managed Care Counseling and Assistance Program, which to help people navigate the information on insurance and prescription drugs. So during the annual enrollment period especially, but all year round, you could call our helpline, which is this 800 number, 800-333-4374. And we have very experienced and very good counselors who will help you free of charge and without bias. We're not going to sell you anything. We're not going to do anything except give you the information that you need in order to make an educated decision regarding healthcare or your rights. And it's not only for you, but also for your help for your loved ones. And the other one that we have, the other helpline we have, is the New York Senior Medicare Patrol, which is our federal grant. We are the New York State federal grantee, where we assist people to prevent, detect, and report healthcare fraud, errors, and abuse. In COVID, fraud has jumped up in stratospheric numbers. So our counselors are there to help you with that. The other thing is we make presentations to community groups free of charge again. So if you have any questions or if you'd like us to come present in your organizations, we're more than happy to do that. The other thing that I wanted to tell you about, which is about this area, is the Central New York Health Task Force, where in 8 counties in Central New York, we're exploring with different stakeholders what the barriers are to people accessing healthcare in Central New York specifically. And from there, after knowing what the barriers are, we work to empower residents in the process of advocating for improved access to health care in Central New York. If you know anybody, or if you'd like to become part of this group, it's open to anybody who's got an interest. Please give us a call. Again, 800-333-4374, and we'll be more than glad to give you more information. One initiative in Central New York that we're very excited about is that we are partnering with the 211 and the library system and other local partners, pioneering a telehealth access initiative, which offers Wi-Fi access at community sites. What we're doing is, because there are so many broadband issues and connectivity issues for people of all ages, this program is not just for seniors, it's for anybody who has a need. What we do is we connect you in your community. We could let you know what libraries or what organizations have free Wi-Fi. Maybe they'll have equipment also for you to schedule a telehealth appointment, to conduct a telehealth appointment, and to find out more information. So I think I'm going to leave it there. I want to thank you for having us, and maybe at a future date, we'll be able to provide more information. Thank you so much.
Great. Thank you, Maria. I know you had to squeeze that in, but we really appreciate that information for sure. And I think this presentation has really included a lot of great resources. I know it was a lot for everybody to kind of absorb. So I just want to share my screen real quick and just share again the website for this event. And just to keep that in mind, there it is. Go on there. We're going to post these resources that everybody talked about today. If there's some question that you have that can't be answered through the website, you don't find it anywhere, go ahead and shoot an email to that email address there, elder@omblp.org. And that's my phone number as well if you have any questions as well that you can't find on the website. But we know it was a lot to take in. As Maria said, if we find that there's more resources that would be beneficial to you all who attended today, we'll absolutely add that to that website. And maybe we'll do some more videos like this if we find that there's more information for everybody to know. So we thank you so much for joining. I'm going to leave that up on the screen for a bit so everybody can get it. And thank you so much to our speakers today. Really, really great information. We were so thankful for having you. Take care, everybody, and maybe we'll see you next week for our next presentation. All right, thanks, everyone.
Oh, I dropped my glasses. Okay.